Hello and welcome to the 27th Degree with Chris and Nancy. We're taking a little break from the studio this month, and we're doing this from my office. So we're going to do a Ask Your Doctor series, and we're going to talk currently about vaccines. But before we get going, I want to thank Bay Coast Bank, our sponsor. Bay Coast Bank is just right for all of your financial needs. Visit baycoast.bank or call 508-678-7641 to learn more. In Duncan Hearing Healthcare you can trust, with sites in Fall River, Dartmouth, Falmouth, and Centerville. For more information, visit their website, duncanhearing.com. As always, you can support the 27th Degree with Chris and Nancy by subscribing to us on YouTube or your favorite podcast platform, and by following us on Facebook and Instagram. Also, please remember to leave a review. It's greatly appreciated. So, Nancy, what do you want to talk about?
I want to talk about vaccines.
Okay.
And the four big ones, I think: flu, pneumonia, shingles, and COVID.
Great. Okay.
So let's start with flu.
Sure. Yeah, so flu. You got some statistics. Do you want to throw those out there?
I do. Close to 5,000 people died 2021 to the 2022 flu season.
Right.
So pretty significant amount.
Yeah,
still, I would say.
And it's not only the people who die. People get really sick and don't die, but are out of work for a week or two, or have serious comorbidities or complications from the flu. But the 5,000 number always surprises people. I think that's actually low, because we see a lot of our older people who end up dying of pneumonia, which is post-flu. And, it gets recorded as pneumonia, but the reality is they had influenza first, and that they wouldn't have had bacterial pneumonia if it weren't for the flu. So I think these numbers are low.
Yeah.
So the flu vaccine, I think, is very safe. It's something that I recommend to all of my adult patients. It can be given to children, of course, too, but I don't take care of children. So I'm going to talk mostly about the adults in my practice. Basically, anyone who is in my practice is offered a flu vaccine.
Okay.
It's particularly important for those who have risk factors for severe disease, and those would be ones with underlying heart disease, underlying lung disease, diabetes, or those who are immunocompromised. The very old are immunocompromised, and they fall into that category. And these are the patients that develop complications such as post-flu pneumonia, and those are the patients who often will succumb to the disease. But even the younger, healthy people will sometimes develop serious complications, and they can develop cardiomyopathies, heart issues, a variety of complications that can be quite serious. So I think anyone really who can get the vaccine should be offered it. It's really quite benign. There are a couple contraindications.
Okay.
The only ones that are really notable are a prior allergic reaction to the flu vaccine.
Okay.
And those who have a sensitivity to eggs, or an allergy to eggs. And that's because a lot of these flu vaccines are developed through egg mediums. There are vaccines that aren't developed that way now, but you need to be aware of what vaccine your doc is offering.
Okay.
And, as far as the allergic reactions, it's not real common, but it does happen. Certainly if someone had a flu vaccine in the past and had swelling around the face or difficulty breathing, they should never have one again. And once again, if they were to have, I didn't say this yet, but if they were to have something called Guillain-Barré with the flu vaccine, that's something that they have to be careful about. So Guillain-Barré is a really unusual condition. I've seen it a handful of times in 25 years. It's an autoimmune condition that basically causes muscular weakness. Okay. And although it's usually self-limited, it can be it's something that is really permanently devastating, let's say. So patients can have long-standing weakness. Now, I don't want to scare anyone away from getting the flu vaccine, because, as I mentioned, I've seen this a handful of times, and maybe once or twice associated with the flu vaccine. I've given out tens of thousands of vaccines. It's really, really rare. But if you've had it, you shouldn't have the flu vaccine again for that reason.
Now, what about the myth? If I get a flu vaccine, I always get sick, so I'm not going to.
Right. So there's two things here I will say to that. So there was an older flu vaccine that we used many, many, many years ago, which was a live virus, and people would at times get full-blown influenza. The virus we've been using for many years now is not a live virus, so you're not going to get the flu. What happens, however, after people get the vaccine is that for the next couple of weeks, they blame everything that occurs on the vaccine. Now, there's a couple things that can happen. You can get influenza right after getting the vaccine because you haven't mounted an immune response yet. That's not a failure of the vaccine, and it's not that you're getting the flu from the vaccine, but patients will often relay it to that. Or you can develop some other viral infection, and with that, have issues that you believe are from the vaccine. So.
Now, when can you get the flu vaccine? Like, it's not offered all year round.
No, I mean, it comes out in the fall. We don't really see flu until probably after October. So if you get it in October, you're fine. But the interesting thing is that a lot of the pharmacies offer it really early. They'll have it like the beginning of September.
Yes.
You don't need to feel compelled to get it that early. There's probably some advantage to waiting a little bit. But
is it the same? So like the vaccine you get in September is going to be the same concoction
same
that
thing.
You get?
Same thing. There's one vaccine per year. Basically what happens is the flu virus, it mutates from year to year. It starts probably over in Asia. It makes its way here and then to Europe. So basically what we're doing is developing a vaccine based on what the current strain is in another part of the world. Now, what can happen is it can mutate some more, and you may end up with a vaccine that's only partially effective or, not as effective as we want. Most of the time we do pretty well, but there have been years where the vaccine has not been greatly effective, unfortunately. You don't know until you get it out there and you see how people respond.
Yeah. Now, you made an interesting comment. Mm-hmm. You said that it's probably a little bit better if you get it later rather than in September. Why?
Well, with a lot of vaccines, your immune response is really brisk in the beginning. It takes a little while to develop. So the first couple of weeks, you don't have much of an immune response, and you develop a pretty brisk response. And then it will wane slowly over a period of time.
Oh, okay. That makes sense.
So I get my vaccine in October. I mean, I don't see cases hardly ever in October, so I think that's fine.
Yeah.
And then it kind of ramps up as the winter progresses, and the fall and winter progresses, I should say.
Now, if you just spaced it out or haven't had time to go run and get it, like in it's January, February, is there still merit to getting it?
Yeah, we'll see. And we will see flu cases into March and April and sometimes May.
Nice.
You get into June, you're not really seeing flu much anymore. But no, there's definitely a benefit to getting it, even if you're getting it later. If you forgot to get it at the beginning of the season, you can get it in January or February or even March if you want.
Nice. So say you are sick with the flu at home and you're feeling terrible. What do people feel like when they actually have the flu?
Well, you kind of feel like you got hit by a truck. You're just achy everywhere. And that's what differentiates a cold from the flu.
Yes.
So, cold, you'll have a cough and you shouldn't have much shortness of breath. You'll have a runny nose. With the flu, you'll have the cough, you'll have the runny nose. You might have a little shortness of breath. Not a lot, a little. If you have a lot, that's a problem. But you'll just feel achy, and you'll have you don't want to get off the couch. You're just tired and achy. You just want to sit there and watch TV, and that's what I think differentiates the symptoms of the flu from the common cold. There are a couple things you can do. First of all, you have to be aware that if you develop shortness of breath, you need to be evaluated. You shouldn't have severe shortness of breath with the flu. You might have a little bit that goes along with the cough, but it shouldn't be severe. If it's severe, you need to call your provider, your healthcare provider, and talk to them about it, because you could have pneumonia or another complication from the flu. So you can do one of two things. If you're young and healthy and it's not too bad and you want to just use over-the-counter meds, Tylenol, anti-inflammatories, the common cold and flu meds are fine. But there's also a medication out there, and I'll use the brand name. It's Tamiflu. And that helps quite a bit. It shortens the course of the infection and the severity in many instances. And it's especially good for patients who are at high risk for complicated disease.
Nice. Anything else on flu?
No, I think that's it. I would just say, get the vaccine. I mean, it's really safe unless you have a true contraindication, which is really rare. I would say that this is something that can be really helpful. And even if, you say to yourself, look, I'm not going to get serious disease and end up in the hospital. Well, first of all, you don't know that, but even if you're in a healthy category, who wants to be really
wants to be miserable,
horribly ill and out of work for a week or more?
Right.
It can be really devastating.
Primacare is Southeastern New England's trusted leader in medical care. With offices in Fall River and surrounding communities, we're dedicated to your well-being. Our carefully selected team of more than 150 providers offers world-class primary and specialty medical care. Primacare doctors are supported by a skilled staff trained to deliver comprehensive radiology, imaging, and testing services. Primacare is large enough to take care of all your medical needs, but small enough to care for you personally. Primacare is by your side.
All right. So thank you for the flu.
Yes.
We'll go on to pneumonia.
Sure.
Latest stat for pneumonia. 41,108 cases that CDC recorded in the year 2022.
Okay.
Quite a lot.
Yeah. And many of those cases are probably post-flu cases that get thrown into the pneumonia category, by the way. But anyway, there's a lot of pneumonia out there, and we do have a vaccine for the pneumococcal variant. So there's lots of types of pneumonia. Pneumococcus is one type. It is probably the most common type, and it's associated with a high risk of death and complication. We can't vaccinate against every type of pneumonia, unfortunately, but we have a really great vaccine for pneumococcal pneumonia. Now, the patients who will get really sick with pneumococcal pneumonia, it could be anyone, quite honestly, but the very young, the very old, and the immunocompromised are the ones that you have to really worry about. And also those that have underlying lung disease, heart disease, diabetes, or are immunocompromised. Patients who've had their spleen out are immunocompromised. These are all patients that are particularly high risk. Anyone who is over 65 or older should get the vaccine. It's very well tolerated, very low incidence of reactions or immune reactions. There are some, but it's not common. And then those who are younger, who have risk factors, underlying lung disease, heart disease, diabetes, their spleen was out, they should have actually been vaccinated before their spleen came out, and that generally happens. But these are patients that really should get the vaccine even at a younger age.
And not yearly,
No, it's not a yearly vaccine like the flu. I mean, if you're a pretty healthy person and you get it at 65, you probably don't need to get revaccinated, although some docs do revaccinate. And those who are at high risk, there's probably more of an interest in revaccinating those folks. But for most of us, you can get it at 65 and you're probably okay.
Nice. All right, moving on from pneumonia to shingles.
Yeah, so shingles, we have a great vaccine for that also. So this is a really terrible condition that can be really painful and life-altering. So the shingles is from the chickenpox vaccine or varicella vaccine. Now, most younger people, I would say all younger people for the most part, get the varicella vaccine at this point. So they're not going to get chickenpox, which is how we end up with shingles. So if you're younger and you get the varicella vaccine to prevent chickenpox, and you've never had chickenpox, which you shouldn't, if you have the vaccine, you're not going to get shingles. But for us folks who did not have a vaccine available, like Nancy and I, we had chickenpox, and mostly everyone our age had chickenpox. And chickenpox, if you recall, is a virus that causes these little fluid-filled, very intensely itchy, what we call vesicles throughout the body, and they can be scarring. It's generally not something that someone would die from, but you might want to die from it if you have it, because you're literally scratching your skin off. And the virus is never completely cleared. It lives dormant in nerve roots, and then at times as we get older and our immune system is weakened or is taxed in some way, or there are other issues, we're on chemotherapy or we're on prednisone or we have a lot of emotional stress, we can get shingles, which is a reactivation of the virus in the nerve root, and the virus follows the rash will follow the pattern of the nerve root. So often it'll start on the back and it'll wrap around to the front. That's a common place. Or the lower back and it goes down the leg. The worst is if it's on the face. That can cause visual issues if it involves the eye. So we want to prevent that. We have a vaccine now that is very effective in doing that. And it's a 2-part series. It's one vaccine, then a month to 6 months after you do a second shot. If you go past that point, you really should revaccinate. I will tell you that it's shingles, it's not just the pain that's associated with shingles and this terrible unsightly rash that occurs that is an issue. It's the percentage of patients that get permanent, long-standing, painful post-shingles neuralgia. So they have nerve pain that lasts potentially for the rest of their life. That can be treated with medications, but it does have side effects. The medications don't always work. So the name of the game here, what you really want to do is prevent it, and you prevent it by vaccinating. It's a very well-tolerated vaccine. Sometimes patients feel a little tired and maybe they'll have a low-grade fever or just feel a little logy for a day, but believe me, it's much better than getting shingles.
What age do you start recommending the shingles shot?
I do it at 50, and that's
Okay.
what most insurances pay for.
Okay, perfect. And if you do get shingles and you're miserable and you're at home, is there anything you can do to, like, over-the-counter stuff? Or
Now,
what do you-
there's
what do
really
you
not
recommend?
anything over the counter that's terribly helpful, unfortunately. We'll often prescribe there are prescription meds. If you catch it really early,
Yep.
within the first few days, you can give a antiviral that will help.
Okay.
But there's not any great over-the-counter meds. And if you do have it, you have to be very careful to not expose yourself to others who have weakened immune systems. Those on chemo, those who have maybe HIV or AIDS, the very old, the very young, like newborns who haven't yet been vaccinated for
Right.
varicella,
Right.
and pregnant women. And that's particularly important because if they develop varicella while they are pregnant, and pregnancy is a state of your immune system is somewhat weakened during pregnancy. So if you were to develop it could have serious manifestations in the unborn child. And they can have birth defects and whatnot.
Just speaking of that too, I've heard you say before that we don't think that as we age, our immune system gets weaker.
Yeah.
But can you talk a little bit about that?
Yeah, I mean, it does. I mean, basically, we're never surprised to hear that patients develop failure of their heart or lung failure or dementia, which is brain failure, or kidney failure. But people are always surprised to understand that the immune system, which is a system, right? It's kind of its own organ system, fails over time. And because of that, we develop increasing infections as we get older. And one important thing to keep in mind, and this is really crucial, is that antibiotics don't cure everything. So antibiotics work in concert with the immune system. So if you have someone who has a deficient immune system, antibiotics may not necessarily resolve whatever infection you're trying to treat. They have to work in conjunction. This is why, I mean, if antibiotics did everything, right?
Yeah.
People who have end-stage AIDS, they wouldn't die from it. We just keep giving them more antibiotics.
It's a really good point.
But, we know that patients who have AIDS, patients who have leukemias, where their immune system is incredibly deficient, the antibiotics will help, but at some point they may not help because you need to have a working immune system.
Nice. Thank you for that on shingles.
Yeah, no problem.
And lastly, let's talk about COVID and the new strain that's out there.
Yeah, so there's a new strain called the flirt strain. The good news is it's kind of a milder strain for most patients, but you still see patients who get really sick, and there are those who are at risk for complicated disease who will develop it. There is a vaccine that will come out this fall that will be directed towards the newer strain. At least that's our hope, and that's what's being worked on. And it should be out in the next month or two, I would think, certainly by October. I would recommend that anyone who is interested in getting the vaccine, anyone who is at risk for complicated disease, and we've talked about those risk factors already, and really, anyone who just wants it because they don't want to get COVID, get the vaccine. It is, although there's a lot on social media about the vaccine that concerns people, I really do think it's a generally safe vaccine for most persons. There are some people who had bad reactions to the COVID vaccine previously, and maybe they shouldn't get it. But I think for most patients, particularly those who are at risk for complicated disease, get it. If you're young and healthy and you don't want to get it, that's fine. It's a personal choice. It's always a personal choice with this vaccine, but I think that it does help out quite a few people out there.
So I have two last questions for you. First, if I just had my doctor's appointment in April or May, and now I know I need the flu and everything, do I make an appointment with you? Do I just go to the pharmacy? Where am I getting these vaccines?
So most of the time, the COVID vaccine you're going to get from the pharmacy. There are some offices that give it, but it's not as common as you would think. So
Okay.
you're going to get it from the pharmacy. Many pharmacies want you to make an appointment. Sometimes you can just
Okay.
walk in.
Yep.
Now, flu vaccines you can get almost at any
Yes.
doctor's office.
Yeah.
But you can get the flu and the COVID vaccine together if
Okay.
and make it easier on yourself. You can do that.
That
if
was
you
one of
want
my
to.
questions too. So what can so I guess I'm old because I qualify for almost everything except the pneumonia, right?